Quadrants of abdomen. The abdomen is an important part of the human anatomy and consists of 4 distinct quadrants: the right upper, right lower, and left lower. Each of these quadrants contains vital organs that support digestive and other bodily functions. By understanding each of these quadrants and the organs they contain, it is possible to gain a better understanding of how our bodies function as a whole. Left upper abdominal quadrant. The left upper quadrant of the abdomen, or lobe, is located just below the ribs and above the left hip bone. It's an area that contains a number of organs and structures, including the spleen, large intestine, stomach, and part of the pancreas. Pain in this region can often be indicative of several medical conditions. Right upper abdominal quadrant. The right upper quadrant, roof, of the abdomen is located in the upper right corner of one's stomach. It is bounded by the diaphragm above, left side to the midline, and below by a line drawn from across the bottom of ribs 9 and 10. This region contains organs such as part of the liver, gallbladder, pancreas, parts of small intestine, and kidney. The most common causes for roof pain include gallstones, appendicitis, and gastritis. Left lower abdominal quadrant. The left lumbar quadrant, LLQ, of the abdominal regions is an important anatomical region. It contains multiple organs and structures that are vital for normal functioning of the human body. The left lower quadrant contains the descending colon, sigmoid colon, bladder, ovaries in women, and part of the rectum. The LLQ is especially prone to common medical conditions such as diverticulitis, irritable bowel syndrome, IBS, ovarian cysts or masses in women, appendicitis, and urinary tract infections. Right lower quadrant. The right lower quadrant, RLQ, of the abdomen is on the lower right side of the torso and contains several organs, like small intestine, appendix, cecum, ascending colon, and right ovary in women. Anatomical landmarks. Anatomical landmarks are important when it comes to understanding and identifying the 4 quadrants of the abdomen. The umbilicus, or navel, is the most commonly recognized landmark as it sits in the middle of the paunch and divides it into 4 sections. In addition, 2 vertical lines can be drawn from this point to create 4 separate quadrants: right upper, right lower, and left lower. Interpreting symptoms of 4-quadrant abdomen. Interpreting symptoms is an essential part of diagnosing any medical condition, especially when it comes to the abdomen. Abdominal pain can be caused by a wide range of conditions such as appendicitis, kidney stones, and gastroenteritis. It is important for health professionals to accurately identify the source of abdominal pain in order to provide appropriate treatment. Clinical significance of 9 regions of the abdomen. The clinical significance of the 4 quadrants of the abdomen is immense. Understanding their anatomy and location is vital to medical practitioners for many reasons. The first application is pain assessment. Identifying which quadrant a patient's pain originates from can be an important diagnostic tool to narrow down potential sources and causes of discomfort. Clinical relevance regions of abdomen. The clinical relevance of the quadrants of the abdomen is essential for medical professionals. By understanding the anatomical divisions of this region, doctors can easily identify a patient's diagnosis and accurately treat their condition. For example, if a patient presents with abdominal pain in the right lower quadrant, an experienced clinician will order an imaging study to look for possible appendicitis. Conclusion: Overview of abdominal quadrants. In conclusion, it is important to understand the 4 abdominal quadrants and their anatomical locations. Each of these quadrants plays a vital role in our body's overall functioning. Knowing this information can help medical professionals diagnose any issues within these regions more accurately. Understanding where each organ is located in relation to other organs can also be especially helpful when performing abdominal surgeries.